We were a very close-knit, do or die family. Like if somebody messes with one of us, they got to mess with all of us. Um, we would get into fights every now and again, but in the end, we would come out stronger for it.
So my grandmother was someone who she didn't have proper guidance as to how to raise children, and my mother then repeated that in her life with her 4 children. She did the best that she could with the knowledge that she had, but unfortunately she didn't have anything to guide her.
I would come to school with a black eye or a busted nose, and the teachers naturally would ask questions. They'd be like, who did this to you? And at first I was very hesitant to respond because I didn't want to get my mom in trouble. I thought I did something wrong and I deserved it.
From the time I was probably between 5 and 8 years old, I mean, there was at least one time in a year where we were sleeping in a car or a hotel. I've witnessed my mom on drugs, and she was very, very aggressive and abusive towards us.
But after a while, they're like, no, this is wrong. This is not what they're supposed to be doing to you. So I eventually started opening up, and my siblings started opening up, which led to investigations being opened against my family. I was taken away by the cops. Everyone else was broken up by CPS. They went to various places, have ended up in various places.
So my first family that I was placed with was white or Caucasian, and that was a big difference. Their day-to-day routine was completely different from mine. We didn't sit at the table to eat dinner at my birth mother's home, but when I got into foster care, that was a norm for them, and it was hard for me to sit at a table with strangers and eat dinner.
The only feeling I can remember is fear. I was scared. I was a kid. I didn't know what was going to happen to me.
I didn't have a support system. I didn't have stability. I had no direction. I was still dealing with a lot of hurt and pain, and I still was kind of impacted by the trauma that I was exposed to that I didn't get services for.
Being removed from your home is generally precipitated by some form of abuse. Primarily is neglect, but obviously many of them are also abused sexually, physically, emotionally. Domestic violence, there might be homelessness, their families might be struggling with substance use. So all these factors we already know have a very negative impact on the mental health of children that can last a lifetime. Majority of children do not get ongoing behavioral health treatment, even though, certainly from my perspective, the need is there just by virtue of having been removed from the home. That is a traumatic experience in and of itself.
And they would prescribe you these medications that would make you drooling, like a drooling zombie. Like all I would do there was just like rock back and forth. I was oblivious to all of my surroundings around me. And when I wasn't, I was very angry, I was very violent because I wasn't able to deal with those feelings. The feelings that were killed with the medication. If I wasn't on that medication, I could have gone to some of the groups and dealt with the difficult feelings I had.
Pediatricians who prescribe the medication and child psychiatrists who prescribe these medications are often put in very difficult situations. And that's because parents or caregivers may be coming to them saying, this child is getting ready to be thrown out of the 3rd school that he's been in, and it's really important for him to be put on something. We need something quick, and Ritalin's not enough. Or a very caring child welfare worker may come to the doctor and say, doctor, we're in trouble. This is the best foster placement that this child could ever get. And the foster mom is really patient, but she cannot go another day if we can't figure out a way to control our behavior. Please help. And that doctor is then in a situation where they have a 15-minute med check perhaps allotted for this time, and the resources in the community may be inadequate to actually refer out for additional help. And so they end up using these medications to fill a gap, and it's a problem that we just have to get a hold of and stop.
I got involved with the Center for Child and Family Health as a youth voice, and they began to expose me to what trauma really was. That was an eye-opener for me, because I had a word for what I was going through. I used to get down on myself because I kept making mistakes and I wasn't on the right path, and I was doing things, that weren't always the best choices, and I was angry and upset and I was hurting people, but because I was hurt and I was going through so much and I didn't have a way to process it. I didn't have a way to talk about it. And so when I share that with the foster parents and the caregivers and they're able to see me on this end, it gives them hope. I work with foster and adoptive parents who are caring for children who experience trauma, and we provide them with trauma-informed practice skills that they can use in their home. And that, to me, has been the biggest part of my healing process as well, is that now I know caregivers are getting this information.
My primary focus right now is just to help as many people as I can. I fill out job applications, I'm currently looking for employment, have been for years. I would much prefer to be in a place where I can help people.
Children that end up aging out of the system generally have had an experience of not being wanted. At least that might be their interpretation of the situation. So they very often struggle with self-esteem, they struggle with depression. Their experience is that people who come into your life don't tend to stay in your life. And so it is difficult for them to then form healthy relationships as adults. Their role models have not been there.
Who I am is based on my past, my present, and my future. The fact that you're still here today and you're able to survive shows that you have a resilient factor in you that will allow you to overcome the obstacles that you have faced, but you can't do it alone.
I'm a firm believer that there are things out there, people out there, that would change my life for the better. I just haven't found them yet, or they haven't found me, and I fully intend to look for them. If I can end up with a family that I never hurt, that I never abused, but still loves me and that I still love, then I've done something right. I've done something that is, the opposite of what people did to me.